Oh my God, I'm live. I am live. Today's topic is showering on dialysis with special guest star Bubba. This is Bubba. She's Persian. I think she's around 13 or 14 years old. She gets her hair cut under sedation about twice a year because her hair gets too long and she can't manage it. And if I try to cut her hair myself, it is like I'm trying to murder her. So she gets her hair cut under sedation. I have a few other pets. I have a pet beta fish. His name's Gary, and I used to have a few other fish, but they just died. Hi, thank you so much for joining. I'm going to talk about showering with the dialysis catheter. This is a hot topic, I feel like. When I get new patients into the dialysis clinic and I talk to them about, you have a dialysis cat, because when they get their dialysis catheter, they don't always get the education they need in IR, and that's okay. Like, educating is like a lifelong process. It's definitely a collaborative approach. They do get a handout, but I mean, like, who reads the handouts all the time? So, showering with the dialysis catheter, the rule is that you do not shower with a dialysis catheter. It is a line that goes into your heart, and not your heart, your bloodstream. I hope it doesn't go into your heart. That would be a little too deep of a line. So no showering. That's the line. And that people have a really hard time with, and I don't blame them. If you told me that I couldn't shower with a dialysis catheter, I'd have a really hard time with it. So that's the number, that's kind of how I will start the conversation as you can. And then, they might be like, well, I'm going to shower anyway. So then you need to come up with a new plan. Talk to the provider, give them some more education, and then if they really are going to shower, you need to tell them when the best time to shower. Usually I tell them before they come into the clinic so that we can change their dressing right away. If they need it more often, then I'll teach them how to change their dialysis catheter and catheter dressing. And people do that on home hemo, like they manage their own dressing. So, I mean, I think of people that are on chronic dialysis, they're on dialysis, or they have a chronic catheter, and they're young, they're in their 40s, 30s, whatever year, but they're like, I'm having this catheter for the rest of my life. I'm not showering. So there are a few patients that I have taught how to change their dressing to keep it clean, and I give them supplies to do it at home. And I just document that I've taught them, and that this is their plan and this is what they're going to do. So that's really how I feel about that. There are the rules, and then there's real life. Real life expectations. People that are new to dialysis, they have a catheter while they're waiting for their fistula, then I'm stricter with them. I'm talking about dialysis catheters and showering. So the people with new fistulas or new catheters, whatever it is, if the plan is that they're going to get rid of their catheter in 3 months, I'm just going to be like, this is short term. Do sponge baths, have somebody wash your hair. This is something I think you can do for 3 months with the long-term goal of that catheter coming out, and then you can showering. And people are really good with that. It's the people with the chronic catheters that you kind of have to come up with a different plan. What else? I can talk a little bit about me. I was an inpatient nurse, so I started out as an ADN nurse. I went to the technical school in town, and then I completed my BSN online, and now I am schooled to become a nurse practitioner. Best case scenario, I'll be able to continue in dialysis as an NP, and if I have to wait for a position to be open, then I'll be an NP somewhere else, or I'll just continue working dialysis, or maybe I'll travel. I don't know, who knows? And I have about a year left of NP school, and I'm learning a lot. I love NP school. I love clinicals. I've never spent time in primary care, so I've really enjoyed learning that primary care it's a lot like dialysis. You take care of the same people. It's a lot. I mean, it's family practice. You take care of families, and even though you see a lot of patients, you really get to know them and really get to be involved with their health and their healthcare goals. So I was surprised to find that primary care is a lot like dialysis when it comes to collaboration and wellness and taking care of people long term. Let's see. So did some travel nursing. I ended up back in Wausau. I was really homesick, and I made a list. This is kind of how I ended up in dialysis nursing. I made a list of things that I wanted in my new job. I didn't want to work nights. I didn't want to work a lot of holidays. I didn't want to work a lot of weekends. And I wanted to take care of patients over and over. I wanted to develop a relationship with my patients. I didn't want to just kind of see them whenever they were in the hospital. So that's how I ended up. I was narrowed down to like working in a nursing home or working in dialysis. And I worked as a CNA in a nursing home when I was younger, and I knew that was really hard work. It was hard work, and you still had to work nights. So that's how I found myself in dialysis nursing. And where I work, we do inpatient and outpatient dialysis. So we still have to do some calls, still some night shifts, still some weekends, and I've been there so long now. I'm the clinical lead, so I have less nights and weekends, which I'm grateful for. A long time. It's been like 5 years. Is that a long time? I don't know. I don't know, but I'm lucky. I'm grateful to not have to do. I can do less weekends and less nights. What else? After I was a dialysis nurse for a year, I went and got certified, and I learned a lot. Learning to become a certified dialysis nurse really helped me like put in all of the like theory, like, okay, intradialytic symptoms, crit lines. It really put everything together for me. And then also just doing a little bit longer, I think just the natural progression of like when you first start anything, novice, you're a novice, and when I first started, I was very task oriented and really focused on getting the dry weights, getting the needles in, and just doing everything right. But things at the dialysis center, as we know, it does not always go perfectly. You're not always going to get the needle in. So when I first started, I was like, well, we have to try again. And I just kind of learned that more is not always better. Sometimes you just have to rest that fistula, have them come back in a couple days, or maybe there's something wrong with the fistula, and you need to have an intervention and get a catheter until that happens. Kind of jumping around, but some of the good news is I have 2,000 subscribers. Like, oh my God, 2,000! Oh, I am so grateful for all of you. I can't believe it. I started this, it was a year in December that I've been doing this, and it was kind of as an outlet to talk about dialysis, because if you're not in dialysis, you don't get it, and you really just do not understand anything that I'm saying. So I just am so grateful, because I was a nurse for 8 years. I don't know how long, it might have changed, 7, 8 years before I went into dialysis, and I knew nothing about dialysis before I went in. I took care of dialysis patients, and I was still uncomfortable taking care of them. I'm like, what do I do? Like, they didn't urinate, but they say they never urinate, so do I need to call their provider and tell them that they didn't urinate? But I'm not gonna make them urinate if they haven't urinated in years. Like, is this, okay, now I can share the wealth. Like, this is not like a critical event if your dialysis patient does not urinate. Ask them if it's normal for them. You don't need to report to the provider that your patient didn't urinate during this 8 hours, but they also haven't urinated for the past 3 years. So like, those are things, like the medications that dialysis patients take, like the binders that you always hear about, the Renvela, the calcium acetate, the Renagel. Like, okay, I want to give my patient their binder, but the patient's like, well, no, I need to take that with my first bites of food. And as a like inpatient nurse, I was like, oh, you'll be fine, just take it. It doesn't matter, but it does matter. It matters when you take your binders. It has to be with your food. So I can kind of spread that word, because it's like, oh, it was always taboo to like leave the pills there with the patient. But like, if it's just a binder, like, here are your pills, take it when you eat. Like, this is better for the patient, and just kind of, I don't know. I don't know if what I'm saying is best practice, but I'm just kind of, there's what you should do and then what actually happens. 2,000 subscribers. I'm getting close to like my 4,000 hours to be monetized, and I've been having a hard time making videos because I've been busy with school. So I've been having a hard time with that, but I plan on making a more detailed like crit line video with more visuals of the different slopes. I can bring up, yeah. So I don't know if you have any questions. I wonder if there's like a comments thing here. I don't know. Thank you for watching. What else can I say? Oh, here it is. I found it. Top chat. Okay. All right. If you have any questions, I'd love to hear them. at my 10-minute mark. That's about it. Just wanted to jump on and say hi to everybody. I've missed you. I've missed making videos, but I'm having a good time in NP school, and it'll be summer soon, so I'm excited to have a break from school and be able to do new like dialysis topics for sure, catheters, fistulas, things like that. Thank you all so much. I'm so grateful. I guess it's Saturday is Gratitude Day, so I'm on here just to jump on and share how gracious I am for all of you.